The digitalization of medical images developed with CT, ultrasound, MRI and nuclear medicine techniques which produce intrinsically digital images. The conventional radiology modality has remained separate, and its digitalization process is mainly based on the introduction of phosphoplates that, it must be recognized, do not improve the ergonomics and still depend on the use of cassettes. Nowadays, in addition to the inherent advantages of image digitalization, it's necessary to focus attention on simplifying the user interface by increasing the ergonomics of the diagnostic units, eliminating the use of standard radiographic cassettes, and reducing as much as possible manual operation. Such new technologies must bring benefits to the patients also in terms of examination speed, immediate results, dose reduction, and diagnostic confidence. Another imperative requirement is the integration of such technologies within the other clinical methods that already use a network environment for patient management. In order to meet these requirements, Mecall has developed an integrated and multi-purpose radiography system based on solid-state detector Eidos 3000. The design of the system allows the management of all chest, bone and urgent studies in the examination room with an innovative approach, integrated in a still familiar context for the user: a patient support, a motorized sealing suspension, a flat panel support stand, DICOM-compatible image acquisition and processing system, and a high-frequency generator with a fine focus tube. The transfer of the patient work list from the Hospital Information System, RIS, to the Mecall Eidos RAD console simplifies the examination procedure. As soon as the patient has been selected, the user can choose the anatomical program from the anatomical program list that appears on the image processor monitor. It's therefore possible to set the generator parameters, the grid focalization, the exposure format, the positioner operative mode, the beam filtration, and the image harmonization. The console is, at the same time, an acquisition and single modality image treatment console. The automatic servo-driven positioning allows the user to avoid boring manual operation and save a considerable amount of time which can be devoted to the patient. In fact, the alignment between the detector and the tube is permanent. The focal distance depends on the selected anatomical program. For example, 180 centimeters for chest and 110 centimeters for the abdomen. The removable grid with auto-focusing device eliminates the need to manually swap grids. In addition, the elevating table with suspended and rotating tabletop enables easier transfer of the patient and the execution of examinations with stretcher patients. The tabletop rotation allows free space around the detector for exposures on erect patients or studies of extremities. If required, it is possible to disable the automatic movements of the Mecall Eidos 3000 components. These advantages speed up the examination procedure. Practically, it means a higher number of patients treated in the examination room or an equal number of patients using less room. The space saved can be employed for other purposes. The system positions are pre-programmed, which means automatic positioning for the selected operating mode. The main modes are the acquisition of images in AP and lateral positions with supine patients, and the acquisition of images in AP and lateral positions with patients standing up. Practically, the Eidos 3000 system receives the work list of the patients from the Hospital Information System, RIS, in which the examinations are scheduled. Once the data has been imported into the Mecall Eidos RAD processor, the patient is selected and connects at the dressing room. The Mecall Eidos 3000 system, pre-programmed for the examination of this patient, automatically moves to the final position under user control. The patient is placed on the tabletop. The tabletop is rotated to bring the patient into the exposure area. The detector is synchronized with the ceiling suspension and is always aligned with the beam. The final positioning is under the control of the operator, who positions the laser localizer on the anatomical region to be examined. The pre-programmed collimated dimension of the irradiated area can be corrected to suit the specific patient. The image is acquired with pre-programmed parameters determined by the operator. The image display is practically immediate. The acquired images are immediately available. If necessary, they can be corrected using the post-processing tools, contrast brightness adjustment, edge enhancement, uniformity and gamma correction, and displayed on the image processor monitor in different modes: full format, divided format, mosaic format. It's possible to add pre-programmed or personalized text on the image. Now the images can be forwarded through the hospital network to a multi-modality console or to the selected laser printer. In the case of lateral exposures, the positioning is automatic and comfortable for the patient because most of the movements take place out of the field of vision. The pre-positioning simplifies the manual operations. Thanks to the anatomical programming, the operator can concentrate wholly on the patient, thus making him or her feel more reassured. At the end of the automatic positioning, the user, as previously described, can refine the beam alignment using the laser localizer and correct the dimension of the irradiated area to suit the specific examination. The detector can be placed as close as possible to the patient thanks to the reasonable width of the patient tabletop. If the width were too great, it could be necessary to laterally slide the patient on the tabletop, a very uncomfortable situation both for the user and the patient. The patient can easily leave the examination table thanks to its rotation and elevation capabilities. Special examinations of knees and feet under load demonstrate the easy use of the Eidos 3000 system. The tabletop, once rotated, totally frees the space to leave access for the detector and the X-ray tube, with a detector center-to-floor distance that can vary from 36 centimeters to 1.95 meters. The minimum distance of the detector from the floor simplifies the execution of the knee under load studies and reassures both patient and user in the case of feet under load studies. The images are immediately available, completing the examination and allowing the patient to leave in a short time. Once the film layout has been prepared, the images can be forwarded to the selected laser printer. The film of the first patient is checked on the viewing box. The film layout can be the high-res RAD one or a combination between the high-res RAD and the laser printer one. Even in the case of chest exposures, the positioning of the Eidos 3000 system is automatic. Once the lead protection is placed, it's possible to proceed with the adjustment of the detector height by means of the up-down foot pedal controls. In this situation, the X-ray tube follows the detector's vertical movement. The collimator field is adjusted in order to expose only the area of interest for the examination. The final image is perfectly defined in terms of spatial and contrast resolution, with the use of a dose that is lower than in conventional film exposures as a result of state-of-the-art detector technology and the carbon fiber patient tabletop, in addition to the removable grid with auto-focusing device. For this wrist examination with the patient in a wheelchair, the grid can be removed and it's possible to position the anatomical part at the edge of the detector area. Now the synchronization between the tube and the detector is disabled. As in other imaging modalities, the dose is measured and automatically displayed with the image. It's possible to obtain specific positions through the preset features of the positioner and/or the exposure factors, with or without synchronized movements according to the user's choice. This allows the execution of examinations with oblique projection, such as the shoulder, for which a stool must be positioned under the detector. The acquisition of an optimal image always requires the adjustment of the beam alignment and of the dimension of the irradiated area. The same is valid for femoral patellar articulations with the patient on a stretcher. Eidos 3000 is a multi-purpose radiographic system with flat panel detector that introduces a new concept of images, time and space management. Thanks to the DICOM 3 compliant image processor, the Mecall Eidos 3000 system perfectly integrates in the X-ray department or hospital network. In conclusion, Eidos 3000 brings greatly improved productivity by means of a strong ergonomics based on patient work list with examinations displayed on the monitor, automatic positioning of the system, automatic forwarding of images to the laser printer or over the network. Eidos 3000, an excellent image quality achieved through cesium iodide scintillator technology coupled with an amorphous silicon detector, high spatial and contrast resolution. Eidos 3000, a significant dose reduction achieved through carbon fiber filter top, cesium iodide scintillator based detector technology, removable grid with auto-focusing device. Eidos 3000, improved safety for the patient that is always under the visual control of the user. Eidos 3000, simply smart. Eidos 3000, a Mecall product.